Hi everyone, I'm Dr. Nadia. We've talked a little bit about cholesterol, and there's something just as important that I think that I would like to talk a little bit with you about, which is diabetes. I think that we actually may know a little bit more about diabetes and a little bit more clear about what actually causes diabetes than we are about cholesterol, but I don't think that people fully comprehend the consequences of having diabetes and how important the prevention of diabetes is. I think that people probably know that there is somewhat of a relationship between diet and diabetes. I think that people probably know there's a relationship between the consumption of certain foods and diabetes, and also the relationship between being overweight and diabetes. I don't know that so many people know, and they should know that there's also a big relationship between diabetes and cardiovascular disease. So this is more of the focus that I want to talk about today. So a few basics about diabetes. There's basically two types of diabetes. There's a type 1 and type 2. I think people have often heard this. Type 1 is mostly diagnosed in children. It's a disease where the pancreas is not able to produce insulin, and consequently the sugar in the blood rises to abnormally high and very dangerous levels. So in these cases, it's important to use insulin as a drug, and it's injectable normally on a daily basis in order to control the sugar in the blood. And obviously the sugar in the blood increases from the dietary consumption of glucose, fructose, the carbs in our everyday diet. Type 2 diabetes is actually something that evolves and normally is diagnosed later in life, although unfortunately more and more we're seeing younger people getting diagnosed with type 2 diabetes. And this is a result of what's called insulin resistance. And this means that although your pancreas is secreting insulin as a response to the sugar level in your blood, over time, as more and more insulin is produced, your body becomes resistant to it. This is like what happens with any other drug or hormone. So let me give you an example. A drug addict gets a certain high, let's say, from a certain drug, but the more that they use it, the more that they introduce this drug to their system becomes more tolerant to it, meaning that they will actually need a higher dose of the drug to get the same sort of feeling from the drug. So this is kind of what happens with insulin. And this was very well explained actually by Dr. Jason Fung, who's a diabetic specialist in Toronto, Canada, and someone who I follow very closely, because different than many of our doctors, at least in conventional medicine that we see nowadays, he's a true believer, even though he is a medical doctor, he is a true believer that diabetes should be treated by diet and actually can be reversed. And this is something that we saw a lot up until the 1920s. So 1921, actually a Canadian doctor, along with some other people, actually developed insulin, the artificial insulin. They discovered insulin and they developed it, and it started becoming commercialized to people through the pharmaceutical companies. And so I believe it was a huge medical leap in the sense that it saved a lot of children, a lot of these young kids that were dying with insulin. They were wasting away with diabetes, were all of a sudden able to have a long, hopefully healthier type of life. What happened with the incidence of, or with the introduction of insulin and then obviously other diabetic medications, is that a lot of focus has been put on treating diabetes with drugs and very little focus actually on nutrition. I think people do hear that, oh, you're not supposed to have a lot of sugar if you're diabetic, or you're not supposed to have refined carbs if you're diabetic. But if we look at our dietary guidelines, and still the dietary guidelines for diabetics, they still say that you need a certain amount of carbs. And I think overall, let's just say that people have very much decided that diabetes is to be treated with diabetic medication. So luckily, I do get a lot of people that come to me at the pre-diabetic stage, and we are able to quickly reverse diabetes. Of course, there has to be a control, we have to monitor these patients very closely, and I do this, and I believe their doctors probably do as well. They're medical doctors, and they also follow them very closely. They may not agree with the type of diet that I often put people on, but the truth of the matter is that it works really well. So basically, what happens to everyone is that once you consume anything that has um, sugar, so glucose, fructose, so this is anything from any carbs, so it could be grains, fruit juices, candy. Anytime sugar goes into your bloodstream, it has to be tightly maintained at a certain level. If it goes above a certain level, it's actually quite harmful, and it's the body's priority to always keep that sugar leveled as long as it can. So what the body does is it produces this hormone called insulin. So insulin is released into the body, and insulin's function is to take this glucose that's in the blood, or fructose, and to channel it through different organs, mostly through the liver, to then store it as glycogen to be used later for energy, and eventually to store it as fat. So the excess is stored as fat. So this is why I think, and we will talk about this, I'm sure, a lot later. It's really important to realize that the stored fat that we have in our bodies has actually been saved there from the carbs that we've actually consumed, and not from, maybe you would think, other foods. It's really the carbs that are uh, the fuel source to give you your energy most of the time, but also they're stored as excess fat in your body. So insulin does this. Insulin does a few other things. One of the things that insulin actually does through the liver is to produce LDL cholesterol and triglycerides. So this means that when you consume carbs and high sugar and fructose, you're actually um, leading the pathway to your body to produce LDL cholesterol, which is the bad cholesterol, as people call it, and also to produce triglycerides, which is the actual fat in your blood. So, what happens right away when you go on an LCHF diet is that you reduce the amount of carbohydrates that you consume, that you eat, and you increase the amount of healthy, real fats that you eat. Within a few days, and this is important to note, because when people go on an LCHF diet, depending on how moderate or restrictive it is, their sugar levels actually change quite drastically. So there is a precaution here. There's no contraindication, but there's definitely a precaution. If you're a diabetic that's already on diabetic medication, you will have to reduce your medication, your dose, gradually until you can actually eliminate it. And this is obviously a really good thing, but it does have to be monitored. So you have to do this through whoever the practitioner is that's helping you through this diet, and even your own specialist. So this is obviously a great thing, because this is what we want. We want to get people off medications, and we want to get them to healthier, and we want to be able to reverse, if possible, diabetes. So important to note, one, when you reduce the consumption of carbohydrates on a low carb, high fat diet, not only do you normalize people's blood levels and insulin levels, and you decrease their dose of um, medication, the one very important thing that happens is that you also lower your LDL level and your triglycerides. So what does this mean? This means that not only does diabetes highly increase your risk of cardiovascular disease, but an LCHF diet for diabetics will lower their cardiovascular risk immensely. So you can now see how there's a huge connection between diabetes and cardiovascular disease.